Hello friends, welcome back to my channel Medicine 101. Today we're gonna talk about the lung abscess. So see, from the term it should be clear that from the lungs means lung. The structure is already given over here. And how can you define the term abscess? Abscess means what can you write over here? Let's write then I'm discussing. Abscess means we can write in this way that the accumulations of the pus within a swollen tissue. So we can write accumulation of pus in a swollen tissue. Okay, so for example, if I say it's a cell, or there's a cells over here, and if we get swollen cells, for example, and if we get the accumulations of the pus, okay, let's show the pus over here, accumulations of the pus within this tissue, then this condition that will be regarded as lung abscess. Okay, this thing will be regarded as lung abscess if we see these things within the lung. Now, abscess in general is the accumulations of the pus within a swollen tissue. Definitely, there should be the inflammation process to get this out of the structures. Okay. Now we'll talk about the etiologies of the causes that can cause the lung abscess. Now, normally, what do we know? Try to understand from here that try to understand that the right lung, and is the left one. The right lung that is more nearer, or the more lying to the what? More lying to the bronchus over here. So if we say the bronchus of the right lung, that is more nearer to the trachea. Okay, the more lying to the trachea. So if we say in terms of these things that for whatever the reasons, if we get any kind of the foreign body aspirations, if we get then any kind of the foreign bodies that is coming within the lungs, so the more chances for the foreign bodies to go where within these directions. Really, that should go within this right lung, because try to understand from here there is a more space and there is less space, and due to gravity, the foreign particles, they will get precipitated, or they will get accumulated in the right lower portions. That means we can say in the right lung with the right lower portions, right lobe, we can say also over here, in the right lower lobe we will get the accumulations of the what? The foreign body particles. Now, what are the foreign body particles or etiologies we can see over here in this way? Try to understand from here. The etiologies that can cause the lung abscess over here. First thing we can say the microbes. In terms of the microbes, we can say the bacteremia, or you can also say in terms of the septicemia. Okay, we can say in terms of the food particles. Okay. Or you can say in terms of the, okay, let's use this one, excessive pneumonia. If you get the excessive pneumonia at the time, we can get also this type of the problems. Now see. So whenever the foreign body particles, the foreign body aspirations will get in these cases, what type of the manifestations will get? The causes are, it may be the bacterium for the microbes, or it may be the food particles, or it may be the excessive pneumonia over here. But the most common cause, if I say the most common cause that can cause the lung abscess, the most common cause for causing the lung abscess, that will be the food particles. So, food particles. Now try to understand from here, any individual who is very busy, he is trying to eat very fast. At the time, sometimes the epiglottis is not closed properly. At the time, there is chances for the food particles to go through the trachea, from the trachea, where through the airways, ultimately within the deeper structures of the lung. Now see, whenever the food particles, they will come over here, try to understand these portions, definitely they will cause the inflammations, because this thing will be regarded as the what? Foreign bodies. So body's immune system, it will regard it as what? The foreign bodies. So the immune system, the cells, definitely we can say the different kinds of the inflammatory cells, we can say over here the alveolar macrophage, we can say the neutrophils, they will come over here and they will cause the what? They will form the pus over here along with the necrotic cells. Okay, so if I say over here at first, so whenever the food particles are coming, over here, after that, different kinds of the what? Inflammatory cells will come over here. These inflammatory cells. So whenever we get the inflammatory cells, that will come over here. They will form the what? Pus. Along with that, we can get the necrotic cells also over here. Necrotic cell. Now this whole thing, for example, it is coming over here, and that will get deposited. This whole portions. There will be these will be the what? Accumulations of the pus along with the necrotic cells. Okay. Now this thing we can regard it as. This thing can be regarded as lung abscess. Now if you want to show with another diagram, let me show you here. For example, is the normal lung. Is a normal lung. We're getting the bronchioles, terminal, whatever you can write it. The terminal bronchioles, alveoli. Okay. We're getting in these directions all these things. Now try to understand for whatever the regions, if we get the food particles or any kind of the foreign body aspiration within the lungs, the more chances I have already said you in the right side. So for example, it has come over here. So whatever the problem we will see, whenever the lung abscess we will see, try to understand from here. We'll get okay. Let's draw it more properly. Okay, in these cases we will get this space. Let's draw it first and I'll show these portions. Now see the portions where actually we got the pus formations along with the necrotic cells. These regions that will be empty. Okay, here actually we will get the what? Lung abscess. We can see these things on the radiological findings. We'll get these things where within the radiological findings. In the radiological findings, we'll get this type of thing. Now, sometimes we can also get, if we see the bacteremia, septicemia, sometimes we can get also, see, we'll get the multiple abscess. Sometimes we can get also the multiple abscess. Whenever we get the presence of the too much of the bacteria over here, at that time we will get the multiple abscess. We get the multiple abscess. So multiple abscess. So when we get the multiple abscess, I have already said in terms of the bacteremia, or you can say in terms of the septicemia. Basically, the main bacteria that can cause this type of the thing, that is the Staph aureus. So Staph aureus is responsible for causing in most of the cases. Okay. Now this type of thing will get over here. Now whatever the mechanisms, the protective mechanisms will get within the lungs, that will not let any kind of the foreign body to go within the deeper structures of the lungs. We'll talk about these things right now. For examples, so let's show over here. The bacteria, the bacteria over here are within the throat region, so the mouth. So from mouth or from the throat regions, there is chances for the bacteria to go within the lungs. So whenever it will come from the throat or the mouth regions within the lungs, at first this would go through the what? To go through the trachea, then go through the bronchioles. Now if we see the structures of the conductor regions, especially if we see in terms of the bronchial structures over here, try to understand these the lining of the bronchial structures. If we see, they are lined by the what? Pseudostratified ciliated columnar epithelium. So we'll get the cells over here. They are known as what? Pseudostratified columnar ciliated epithelium. So we'll write pseudostratified ciliated columnar epithelium. Now this type of the cells are having what? The cilia. They are having the cilia. So by the ciliary movement, they will try to stop the foreign bodies. So at first they will try to push it back. So by the ciliary actions, they will try to push it back, these foreign bodies. And there is chances for the foreign bodies, they will come within the GI systems, and they will ultimately within the stomach, and by the actions of the HCl acid, these things will get destroyed. Now another thing we can get over here, whenever the foreign bodies they will try to reach from the bronchus to the inner structures or the deeper structures of the lungs, these cells they will start producing what mucus. So whenever the mucus that will be produced, for example this is the mucus that is produced over here, now the mucus that will get stuck where within the these foreign bodies, this mucus will get stuck within the along with these foreign bodies. So whenever this mucus that will get stuck within the foreign along with the foreign bodies, so there is no chances for the foreign bodies to go within the deeper structures of the lungs. Now if we get that the ciliary actions, the ciliary activity of these cells are not working properly, or the whatever the mucus is producing, the mucin activity is getting less. The mucin activity is getting less. Why? Sometimes we can say in terms of the, try to remember, I have already uploaded on video, maybe you have watched that video. In case of the cystic fibrosis, if we get the mutations of the what CFTR genes, there will be no coming of the sodiums and chloride over here. There will be problem with the sodium and chloride ions. So whenever the sodium and chloride will not come over here, so this fluid that will come over here by the mucus, the cells over here, the mucus that will be thickened, because the mucus that will be in the liquid form, whenever the sodium and chloride will be along with them. So whenever for mutations of the CFTR genes over here, okay, this sodium will be not along with the what mucus, so the mucus that will be get thickened, so we'll get the obstructions over here. Okay, so now we talk about now what are the dysfunctions you can get over here that is responsible for causing the lung abscess. So the mechanisms, or you can say the causes. If we get the dysfunctions at the ciliary level, if we get the ciliary activity that is getting decreased, and another thing, if we get the mucins, whatever the mucus that is produced, the mucins activity that is also getting decreased. Whatever the problem we will get over here, try to understand. Now see, whenever I am talking in terms of the ciliary activity is getting decreased, so definitely the cilia, if we see here, the cilia, they will not be able, for example this is the cilia, they will not be able to what push back the foreign bodies, whatever the foreign particles are coming within this airways, the cilia they will be not able to push back the things. As a result, the chances for the foreign bodies to go within the deeper structures or the inner structures of the lung. Now here basically if we see the cilia that is made up of one type of the protein that is known as dynein protein that makes the cilia over here. Now if we get any kind of the congenital defect where within the dynein proteins, if we get the defect, definitely that's the congenital defect. If we get the congenital defect within the dynein protein over here, as a result the cilia that definitely, if we get any kind of the mutations for what the dynein protein is not able to do functions. Okay, now same thing, whenever the dynein is not functional, definitely the cilia that will be not also functional, so it will be also dysfunctional. So whatever the problem we will see, whenever the dynein protein that will be affected, it will leads to development on top of the syndrome that is known as Carter-Jenner syndrome. So Carter-Jenner syndrome. So whatever the manifestations we will get in terms of the Carter-Jenner syndrome, we'll get the three things. The first thing we'll get over here, that is known as situs inversus. What is situs inversus over here? What do you know normally? The heart, if we say in terms of the heart, that is normally present where within the left side, right? But during embryological stages, at first the heart that will be developed or within the right side. After that, okay, whenever the by the actions of the ciliary activity over here, if we say by the actions of the ciliary things over here, then the heart that will be moved from where? That will be moved from the right side to the left side. But whenever we are talking in terms of the congenital defect for the dynein protein dysfunctional over here, the heart that will be not able to go from the right side to the left side. So definitely we can say from here, the heart that will be still where within the right side. Okay, in terms of the Carter-Jenner syndrome, if we say in terms of the situs inversus over here, for the lacking functions, if we say for the deficiency of the ciliary actions over here, the heart that will be not able to go from the right side to the left side. So this thing is known as what? Dextrocardia. So normally if we just draw over here a little bit, okay. Okay, let's draw a little bit of the heart over here. For example, is the right side, is the left side. So normally we'll get the rotations of how much 180-degree rotations over here, but whenever we'll get dysfunctions of the ciliary activity over here, so these things will be not seen over here. So it will be in these directions only. There will be no movement of the what? Heart from the right side to the left side. The second thing we can get over here that can cause the bronchiectasis. Bronchiectasis. Second thing, it can cause the bronchiectasis. In bronchiectasis, we can get the repeated infections over here. I will talk about these things in the subsequent parts. We will get the repeated infections. And the third thing that can cause the sinusitis. Okay. So paranasal sinusitis. So what type of problems we will get in these cases? See, whenever the ciliary function is lost over here for the defect where within the dynein protein, that can develop the cardiogenic syndrome. Within the cardiogenic syndrome, we got over here the situs inversus, where we will get, for example, the heart that will be not moved from the right side to the left side during the embryological development. The second thing I have said, we can get the bronchiectasis. The third thing I have said over here, that we can get also the paranasal sinusitis over here. Okay. And also for the mucin dysfunctions, okay, if we get, definitely it will lead to the pulmonary infections. Whenever the chances for the pulmonary infection, that will be more, the whatever the mucus that is produced, that is not able to function properly. So there is chances for the foreign bodies to go within the lungs very easily. So that will lead to the pulmonary infection. In the same way, it will also lead to ultimately what? The pulmonary infections. It will opportunistic pulmonary infections will get over here. Okay. Now another kind of a thing is the what? Congenital defect. Now whatever the acquired defect or effect we can say in terms of the acquired regions or the etiology, you can say the cigarette smoking. So if we get in terms of the smoking over here, another cause you can get over here the smoking. See, the smoke particles. The smoke particles, they will try to go over. If we see the ciliary activity is not working properly, so they will not be able to push back the smoke particles in the opposite directions. Along with that, if we get the functions of the mucus, that is also decreased. Try to understand from here. So there is a chances for the smoke particles to go within the deeper structures of the lungs, and that can cause also the abscess over here. And in this case, I have already said you that anaerobic bacteria, I have said in terms of the bacteriemia and septicemia. In that cases, will get the most common, the step aureus. Okay, that can cause also the lung abscess. And with that, if we get the bacteriemia and septicemia, I have already said there is chances for the development of the multiple abscess. Okay. Okay. In this cases. Okay, yes. So now the next thing is over here. We will talk about what the obstructive and restrictive pulmonary disorders and the subsequent parts of the videos. Okay. So thanks for watching. If you don't get any point, please let me know in the comment section. So I'll read your comments, of course.